do's and don'ts as it relates to, I don't want to use the word optimizing. It's gotten me into trouble before because the word optimize or optimal suggests that there's a perfect number that one should all attain if possible. But in reality, optimal is a day-to-day thing, at least. But what should people avoid in order to get their sperm quality as high as possible, their testosterone level? Again, here I have to be careful. I don't want to say as high as possible because some people might not want excessive androgen, but at the high end of normal, perhaps would be the ideal for many people. What should people do? What should they avoid? And here I'm setting aside any prescription clinical treatments that, such as testosterone injections or things like chorionic gonadotropin, human chorionic gonadotropin, things that we can talk about a little bit later. But what should every male be doing in order to optimize these health parameters?
Yeah, so I think that there are some risk factors that we do. Like we'll start with semen quality. So we talked about heat. I think that's a big one. So like hot tubs, saunas, try and avoid those. Some light data on seat warmers. Anytime we kind of get this external heat source to the scrotum. The testicles are outside the body because they need to be a little cooler. So anything that warms them up can certainly be a problem.
Could I just briefly interrupt there to ask, we've done episodes on sauna and some of the health benefits of sauna. Is it sufficient for somebody to bring in a cold pack to the sauna and put that up in their groin? I actually have suggested that. That's actually what I do when I go into the sauna. And I have suggested this on podcasts, not just for people who are trying to conceive, because it seems like heat, as you mentioned, is bad for sperm, not quite as bad for testosterone levels. But is it also true that heating the testicle too much is generally bad for endocrine function in males, and therefore if one is going to go into a hot sauna for 20 minutes or more to essentially cool the scrotal area?
Yeah, I think the spermatogenesis or sperm production is certainly a lot more sensitive. Whether you can sort of thwart the effects of external heat with a cooling pack, I think it makes sense. There are studies that have looked at different ways to cool the scrotum and have compared, semen quality before and after, and there's some data that may help. It depends how long you're going to spend in the sauna and how cold, that pack is going to remain.
So ice pack and in the sauna for 20 to 45 minutes.
Yeah. And is the ice pack still cold afterwards?
Yeah. Yeah, they actually sell, and by the way, I have no relationship to any of these companies, but they actually sell cold packs that are designed to be worn in your shorts. So if you go to I'll go to a Russian banya every once in a while. Now I guess I'm outing myself. Yes, I have a cold pack in my shorts when I go to the Russian banya. But they have a sort of an insulation so that the very cold surface is cold enough, but it's not right up in contact with the scrotal skin, because that could get, I want to make a bad joke and say it could get sticky, that situation. You don't want it being so cold that it actually would stick to the skin, and then it could potentially damage the skin when you try and remove the cold pack. So it has a thin insulating layer, and yeah, that's essentially what it is.
Yeah, frostbite to the scrotum is not theoretical. It can certainly happen. So you do want to be careful.
Yeah.
So in theory, that should be adequate to sort of, to decrease the risk of that particular effect. I keep coming back to health, how important that is to maintain, adequate sperm production, because I think these two are very linked. There have been studies that show that men with more comorbid conditions, so obesity, hypertension, hyperlipidemia, as these sort of stack up, we see a decline in testicular function, so lower testosterone levels and lower sperm quality. So I think, taking ownership of your health, I think, is important as well. A lot of times fertility tends to be one of the first touch points that some men have with healthcare, because generally what brings men to the doctor, it's usually pain or, kind of a problem. So, if men are in their 20s and 30s getting ready to start a family, or 40s in some cases, sometimes they haven't, seen a primary care doctor. So some of these things, some of this relationship has not been established yet. So I think, thinking about ways to start that, I think would be important too. And then I know you don't want to talk about testosterone, but testosterone is actually a fairly common problem that we see in fertility clinics. I would say that, estimates say maybe about 1 in 20 infertile men are that way because of testosterone. So I think when, people get testosterone from different places, and hopefully, whatever provider you're getting it from tells you that one of the side effects of this is lower sperm production. It's actually been tested as a contraceptive, and, with some other agents, it can actually be fairly effective. So we just want to make sure that, if men are starting testosterone, they're doing it for the right reasons and they're doing it safely. I think.
You're talking about testosterone replacement therapy. Although, as we were talking about before we started recording, I am really on a push now to rename what people call TRT, testosterone replacement therapy, because indeed some people have low testosterone and need it replaced, the right. R in TRT. But I think what you're referring to, if I'm not mistaken, is that there are probably millions of young men and older men taking exogenous testosterone, injections, creams, pills, pellets, any number, nasal sprays now, any number of different routes of delivery of exogenous testosterone. And that dramatically reduces one's endogenous testosterone production and dramatically reduces one's sperm count and maybe even quality. We'll maybe talk about this a little bit later, but maybe even I've been told that it can perhaps introduce a DNA fragmentation within the remaining viable sperm as well. So do I have that correct? You're saying that you see 1 in 20 men have issues with fertility because they are taking testosterone.
Right.
So their testosterone levels presumably are going to be high end normal or more, but they are doing presumably not testosterone replacement therapy, but they're doing what I call testosterone augmentation therapy, meaning they were somewhere in the 300 to 900 nanograms per deciliter range, but decided to start taking testosterone anyway. And then their sperm count essentially diminishes to nil or close to it.
In some cases, yeah. So, I think there's various reasons that you would take testosterone. I think, some people have been treated, years ago, and so they do need to replace testosterone, but some people do it for augmentation. I just usually say testosterone therapy, just so it sort of
you kill the R. I like that. That's better than the TAT, which doesn't sound very good. Okay, just testosterone therapy.
Yeah.
Okay.
But if you had, for example, if we take 100 of my infertile patients that come in to see me in clinic, at least 5 of those men will be infertile because they're on testosterone therapy. And some of them do have that suspicion. They say, I'm going to level with you. This is why my levels are probably low. But a lot of men were not told that, when they started therapy. So I think certainly for reproductive age men, that's a very important conversation to have because there can be some other, ways that we kind of maintain sperm production. I think sperm cryopreservation is a good option for these men as well. Or there may be other therapies they can think about just because of reproductive toxicity.
What about HCG, human chorionic gonadotropin? I hear about a lot of people who go on testosterone therapy who take HCG every other day or so. Mm-hmm. Typically the dosages that I hear about, because people write to me about this stuff all the time, really, it's one of the most commonly asked questions. I get many questions about many topics, but I would say a full 10 to 20% of them are about penises or testosterone.
Those are perfect then.
Right, exactly. So a number of those guys who are taking testosterone will be prescribed HCG to stimulate sperm production, endogenous sperm production to maintain healthy sperm, presumably because they either want to conceive or are intending to conceive in the future. Is that the best line of treatment for maintaining fertility while people are taking testosterone therapy?
Yeah, that's one of the therapies that we use, and I think it can work well. Just a low dose, usually, again, for those that know, 500 to 1,000 units every other day is usually